Good morning, everyone, and welcome. Thank you for joining us. My name is Matthew Vino. I'm Executive Director of the Group Insurance Commission. This is the first of two retiree annual enrollment information sessions that we're holding this week. Our second session for retirees will be this Thursday, March 16th at 12 noon. We will also be hosting sessions for active employees starting next week. All of these sessions are being conducted virtually by Zoom, and we will be posting a video of it on the GIC's website, mass.gov/GIC. So we're holding these sessions because we have a wider range of changes this year than in a typical year for the GIC, for reasons that I will address. We are also at the same time finalizing our benefit guides, which we'll be sending out to you very soon. So please keep an eye out for those. One housekeeping note for this session, for the hearing impaired, we have CART services, which will be provided. You can find the link for that in the Zoom chat. Our plan for this morning's session is to do a 30-minute or so presentation followed by a Q&A. So let's jump right in. So here's our agenda for this morning. I'm going to start with a few brief comments about why we're here today. Then we'll jump right into details for Medicare plans about what's changing and what's not changing. We'll then move on to coverage for retirees not eligible for Medicare. Those of you who are on our active plans, again, what's changing and what's not changing. And then we'll close with a few comments about dental and vision benefits and tips for how you can prepare for annual enrollment. On the next slide, you'll see you may submit questions at any time during the presentation using the Q&A tab of Zoom, which is usually the tab at the bottom of your screen. We'll be reviewing questions real time, and we'll respond to as many of them as we can in writing. Again, also in the Q&A tab. With such a large number of participants, we may not be able to get to every question today. But when we finish the presentation, we will verbally address questions that we've received that we think are of a general interest to all in attendance. I also want to note that for those who wish to make a more lengthy statement, we encourage you to send us written comments at gic.info@mass.gov rather than typing it in the Q&A. Again, you can find that email address on our website. Finally, if you have questions about your specific coverage, including personal details, I encourage you to contact us directly using the phone number and online contact form that's noted here on this slide. Again, you can also find that on our website. Please don't share personal information in the Q&A function. We do want to protect your privacy. And just a quick note at the bottom of the slide here, just in case we have GIC coordinators who may be joining us, we are sending you training and other materials very soon. So why are we here today for this session? As I mentioned earlier, this is an unusual year, and I want to explain why that is the case. On to the next slide. So first, we always want to start with our mission, which I hope you're familiar with, puts members and high-quality, affordable benefits at the center of all that we do. And in order to meet this mission, as you know, we provide a full suite of insurance benefits here noted on the right-hand side. So more specifically, we're here today because our annual enrollment period is just a few weeks away. It will launch on April 5th and will run through May the 3rd. As you know, this is the time when anyone that's eligible for GIC coverage can make changes to their insurance choices. And this is for coverage that will start this coming July 1st. So we want to make it as easy as possible for you to interact with the GIC. So we have been hard at work over the last several years, creating an online member portal called MyGICLink, which is now available to you all. It's not a requirement to use the portal. We will continue to accept paper forms, and our staff is, as always, just a phone call away. But in the portal, you will be able to do just about everything online. You can receive updates that we send out throughout the year very quickly. You can review your benefits, update your information, add beneficiaries. And during annual enrollment, you'll be able to compare different options for health insurance and actually complete your enrollment rather than having to print out a form, send it in the mail, and wait for us to act on that. Every state and municipal active employee and retiree that has a valid email address can register to use the portal. So I encourage you all to consider doing so. So I said there are a number of changes to benefits this year, and I want to speak to why that is the case. First, we have to contract at least every 5 years with the companies that we work with to provide your benefits. Second, as everyone can appreciate, the healthcare system is and continues to be constantly evolving. One big change that you've likely already heard of is the merger of two of our longstanding health insurance companies, Harvard Pilgrim and Tufts Health Plan. You also probably know that Always Health Partners has changed its name to Mass General Brigham Health Plan. Aside from the plans, hospitals are also merging into ever larger systems, which tend to make healthcare more expensive, and new drugs continue to come to market, some amazing, miraculous cures, but they often come at enormous cost. So with all of these challenges that face us, we have to adjust our ways of dealing with them. Finally, when we contract with health plans, as you'll see on the right here, it's a good time for us to make adjustments to the features of each plan, the specific features, including member cost sharing. So with all of this going on, that makes this year more change than we would see in a typical year. All right, so with that as table setting, now let's jump into what's changing and what's not changing. And we're going to start with those of you who are eligible for Medicare plans. So the good news here is that there's actually not a lot that's changing. We continue to offer a wide range of choices for your coverage, both Medicare Supplement and Medicare Advantage plans. Second, we're not increasing any copays or deductibles this year for our Medicare plans, so they will be the same in that respect as they are today. There will also be no changes to your prescription drug benefits. We will continue to work with CVS Caremark with the Silver Scripts program. And finally, there are no changes to dental, vision, or our life insurance plans this year. So that's what's not changing. Let's move on to what is changing in our Medicare plans. First, as I mentioned earlier, Harvard Pilgrim and Tufts recently merged into one company called Point32 Health. As a result of that, again, not any decision that was made by the GIC, Tufts will no longer be offering their Medicare supplement plan called Complement. So if you're in this plan today, you will continue to be covered under this plan through the end of June, but during annual enrollment, you will have to select a new plan. The good news is that you have lots of options to choose from depending on where you live. Harvard Pilgrim, Unicare, and Health New England will continue to offer Medicare supplement plans. And for those looking to save a little bit on premium, Tufts will continue to offer Medicare Preferred. That's their Medicare Advantage plan. As always, we want to make sure that no one goes without coverage as we go through annual enrollment. So if you are in Tufts Complement today and you do not actively choose a new plan during annual enrollment, we will default enroll you into the most similar plan. In this case, that's Harvard Pilgrim Medicare Enhance. But it's important to ensure that the plan you enroll in meets your needs. So we strongly encourage members to look over your options and make your own decision rather than have us make it for you. If you're okay with moving to Harvard Pilgrim's plan, we can do that, but this is a good year for you to make sure that that's the right option for you. The second change that I'm excited to share with you here, for those of you who have been in Unicare Medicare Extension, You know that for many years, it has included an optional component called CIC, or comprehensive insurance coverage. You also know that you have paid 100% of that added cost, and the state does not cover a percentage of it as it does with your regular premium. We are changing that. So as of July 1st, we are folding this member pay all cost into the plan's regular premium. So what this means is that the state will now pick up its share of that cost for retirees, again, at the percentage determined by your retirement date. And your coverage will get even better here, since this will all be incorporated into the plan, both the cost and the additional coverage. So for our Medicare plans, this pulls all of this together into one table, which you'll again also find in our benefit guide. Based on the plan you are in today, you can see what plan you'll be enrolled in for the coming year if you do not actively choose a different plan. So that new plan that you'd be enrolled in is here on the right-hand side of the slide. But again, no need to take pictures of this, so scroll down notes. You will see this in your benefit guide. So that wraps up our Medicare plans. In terms of the plan design, we're actually now going to talk briefly about the rates for these plans. So here we show the full cost premium for each of our Medicare plans for fiscal year 24 and how they're changing from this year. I want to be clear, these numbers are not the amount that you pay, which we'll show on the next slide. This is the total cost of the plan, which combines what the state pays and what you pay. But this also does show the how these premiums are changing and the increases on the right-hand side. Now, we understand that any increase in premium is a challenge for our members, especially for those of you on a fixed income. So we try to do our best to have as competitive and lowest rates as we can. That said, we continue to keep the rate increase for Medicare plans quite modest. The average increase in Medicare plans this year is 2.3%, with Unicare growing by 2.8%, Tufts Medicare Preferred at 2.1%, and Harvard Pilgrim by 1.2%. I'll note here that the Health New England premium is actually not increasing. It will be the same as it is this year. So now on to the slide that shows what you pay depending on the percentage that you pay on premium due to your date of retirement. It's a little hard to see, I apologize, but again, this will be in the benefit guides that will be arriving soon. Please note, as you'll see in the yellow box, this does not apply to municipal retirees. The breakdown, you'll have to contact your city or town benefit managers. So that concludes the review of changes to Medicare plans. Do want to remind you here again that if you have questions, you may submit them in the Q&A function, you know, we will be addressing those real time during the presentation. Again, don't share, please, personal information in the Q&A, but rather reach out to us at the phone number or contact information, contact form noted here on the slide. Okay, now we move on to changes to the plans for retirees who are not eligible for Medicare, but instead enroll in our active plans. At a high level, these are the companies that we're working with to provide your coverage starting on July 1st, organized by plan category. I'll speak to the changes that are embedded here in turn in the next several slides. But we will have a new plan, as you'll see in the upper left, offered by Harvard Pilgrim for those members who reside outside of New England. For those in New England, in the upper right, you can choose from a broad range of broad network plans offered by Harvard Pilgrim, Unicare, and Mass General Brigham Health Plan. Again, that's the renamed Always Health Partners. Health New England will continue to be the regional plan available to our members in Western Mass. And in the lower right, you'll see that Harvard Pilgrim and Unicare will continue to offer our limited network plans. So let's go into the changes here in turn. Again, let me start with what's not changing. We continue to offer a wide variety of choices. We're working with many of the same insurance companies, though there are some specific changes to specific plans, which I'll get into. We continue to offer the same types of insurance plans. We have HMOs, which feature a closed network of hospitals and doctors with a designated primary care physician. We have point of service plans or POS plans, which are similar to HMOs, but provide broad access to hospitals and doctors outside of the network. And we continue to offer indemnity plans, which give access to all providers. We also continue to offer, as I mentioned, broad network plans that give access to providers across the state, but also limited network plans for those willing to trade off that broad access for a lower premium. So these are consistent strategies that the GIC has used for many years. I also want to note here that while we are making some changes to co-payments that I'll talk a little bit more about in a moment, we are not implementing broad cost shifting to members through higher copays, deductibles, or changes to your out-of-pocket maximum. Finally, as I mentioned earlier, we are making no changes to dental, vision, or life insurance plans, also for non-Medicare retirees. Also want to note here briefly that we are making no changes to the Health New England plan that's available to residents of Western Massachusetts. So while a lot is staying the same, there are a number of changes to active and non-Medicare plans that you need to consider as you make decisions during annual enrollment. First, as with the Medicare plans, with the merger of Tufts and Harvard Pilgrim, Tufts will no longer offer Tufts Complement, its Medicare supplement plan. We're no longer offering, this for non-Medicare retirees, I apologize. We're no longer offering Tufts Navigator. Second, we've made changes that will mean that some of those options will be different in the coming year based on where you live. Third, as I noted earlier, we've made a few targeted changes to co-payments in some of our plans. And finally, some names of specific insurance offerings will be different. And again, I'll talk through each of these in turn, starting with the Tufts changes. So as I mentioned, Harvard Pilgrim and Tufts recently merged. As a result of that, and not any decision by the GIC, Tufts will no longer be offering Tufts Navigator. If you are in Tufts Navigator today, you will continue to be covered under that plan through the end of June. But during annual enrollment, you will have to select a new plan, or the GIC will make that decision for you and put you in a similar plan, which is the Harvard Pilgrim Explorer plan. The good news is that you have lots of options depending on where you live. Harvard Pilgrim, Mass General Brigham Health Plan, and Unicare continue to offer broad network health plans similar to Tufts Navigator. Also, for those looking, again, to save a little premium, you can consider one of the narrow network plans offered by Harvard Pilgrim or Unicare. It's also important to note that no one will go without coverage. Again, so if you're enrolled in Navigator and you do not actively choose a new plan during annual enrollment, we will default enroll you in Harvard Pilgrim Explorer. If that's okay with you, no action is needed on your part, but it is especially important this year to actively shop among your options. So we strongly encourage members to make your own choices rather than just have us make it for you. So that's the change to Tufts Navigator. Moving on to Tufts Spirit, our narrow network plan. As with Navigator, this plan will no longer be offered this coming year due to the Harvard-Pilgrim-Tufts merger. Again, if you are in Tufts Spirit today, you will continue to be covered under that plan through the end of June. But during annual enrollment, you will have to select a new plan, or the GIC, again, will make that decision for you and put you in the Harvard-Pilgrim quality HMO plan. If you don't choose, we will enroll you, but you do have other options. You can choose another limited network plan called Community Choice, or from a variety of broad network plans offered by Unicare, Harvard-Pilgrim, and Mass General Brigham. So as you've heard me say already a few times, this is a great year to actively shop and enroll in a plan that meets your needs. So moving on from Tufts onto Harvard-Pilgrim, both their broad and limited network plans will continue to be offered, though they will have new plan names, and those are noted here. The Independence Broad Network Plan will now be called Harvard-Pilgrim Explorer, and Primary Choice, that's the existing limited network plan, will be renamed Harvard-Pilgrim Quality HMO. So other than the name change, there's not a lot of changes happening to these plans this year. Moving on to Unicare, the basic indemnity plan is being replaced with two plans. A new plan called Harvard-Pilgrim Access America, that will be the plan for all members who reside outside of New England, and Unicare Total Choice, which will be very similar to Unicare Basic and will continue to be available to those who live in any of the 6 New England states. I'll say more about each of these new plans in the next 2 slides. For many years, those non-Medicare retirees who live outside of New England have been covered in Unicare Basic, and that has been our most expensive plan. So we wanted to try to provide a more affordable option here, and we're pleased that through the recontracting process, we are able to do that with a plan offered by Harvard-Pilgrim called Access America. This new plan will offer similarly broad access to hospitals and doctors with no changes to the copayments and deductibles and out-of-pocket maximums that you've been used to under Unicare Basic, and all at a lower premium than even what you paid last year under Unicare Basic. Also, as I said during the Medicare section, we are removing the member pay-all portion of the premium for CIC, folding it into this new plan's premium. It is important to note that eligibility for this plan is determined by the address you have on file at the GIC. Only those who have a residence outside of New England for 6 months plus 1 day will be eligible to enroll in this plan. So please make sure the address that we have on file is up to date. Make sure we can determine your eligibility appropriately. Now on to the other change from Basic. Those of you who reside in New England, Unicare Basic will now become Unicare Total Choice. We'll continue to have the same broad access to doctors and hospitals, but we are making a few changes to the plan. Again, as I noted, we are removing the member pay-all portion of the CIC program, so that will be folded into the plan, both the coverage and the premium. And second, in an effort to make this plan simpler to use, we're doing away with tiered copayments, replacing them with flat dollar copayments. I'll say more about this in a few moments. The next change is to Always Health Partners. As I mentioned, they're changing their name to Mass General Brigham Health Plan. As with the Tufts Harvard Pilgrim merger, this is not a decision that we made at the GIC, but a decision made by this insurance company as a private organization. I want to make sure that with this name change, you understand something important. Just because the health plan has the name Mass General Brigham in its name, it's not the only plan that gives you access to Mass General Hospital or Brigham and Women's Hospital or any other hospitals in the Mass General Brigham system. You can still enroll in other broad network plans and have access to these hospitals and their affiliated doctors. Second, in the past, this plan has not been available to those in some parts of Western Mass. But we are now able to offer it to any resident of Massachusetts, no matter where you live. So we're expanding choice for this plan across the state. Finally, since this is now a statewide broad network plan, it will have the same co-payments and deductibles as the other plans in that category. So this will mean some higher co-payments and a higher deductible. So if you're in this plan, it's important to evaluate whether it will continue to meet your needs or whether you may want to choose a different plan. Finally, Unicare Total Choice, which again used to be Unicare Basic, and Unicare Community Choice will be largely unchanged. We'll have, although we will have some adjustments to co-payments for a subset of services in those and other Unicare plans. For all Unicare plans, we've added co-payments for eye and gastrointestinal procedures when they're delivered at certain freestanding facilities, as well as for outpatient services. And specifically for Unicare Plus and Community Choice, we've made a few very minor adjustments to co-pays for non-primary care visits. A lot of this is to align these plans with the other similar plans in their different categories. So with the next slide, I thought it would be helpful to pull all of the changes to member cost sharing into one slide here. Again, all of these details will be made clear in the benefit guides and this deck, which the deck for this presentation, which we'll be posting on our website. So I encourage you to review all of those to make sure you understand the finer details here. So before we get into premium rates for the non-Medicare plans, I want to share this table. Again, this will also be in your benefit guide. It shows each plan that we offer today in that middle column and the plan that you will be enrolled in if you don't choose an active plan is on the right-hand side. So when you get your benefit guide, please pay close attention to this table. So to round up our health plan changes, I just want to say a few words about how premiums are changing for our non-Medicare plans. There's a lot on the next slide, and I apologize that we had to use small font to fill it all in. Again, don't worry. If you want to spend time studying this slide, you can pull up the deck that will be on our website, and many of these materials will be found in the benefit decision guide. So again, here we show the full cost premiums for each of your plans for fiscal year 24 and how they're changing from this year. Again, I want to be clear, this is not the amount that you'll pay. We'll show that on the next slide, but this is the total cost of the plan, which combines what the state and you pay together. What I'd like to draw your attention to is the fact that while a few of our premiums are increasing by more than 9%, most of them are increasing by much less, and some plans are actually decreasing. So again, this is a year, one more reason to make sure that you do your homework during annual enrollment, review your decision guides, and make the best choice for you. And finally, on the health plans, this is where we show what you actually pay based on the premium contribution for each of the plans that we're offering this year. As I mentioned before, this table will be included in your benefit guides. Again, you can ask a question at any time during the presentation and the Q&A function. I'm sure the GIC team is rapidly responding to those. So with that, I'd like to turn to a change for non-Medicare enrollees to prescription drug benefits. We are making a change here. CVS Caremark will replace Express Scripts as the company to provide the prescription drug benefit for you. Starting on July 1st, you will need to use your new CVS Caremark ID card when filling prescriptions. CVS will be reaching out to you with a welcome packet and a new insurance card. There are not steps here that you need to take, but you do need to be aware of a few things. If you have a reoccurring prescription, we recommend that you take your new insurance card to the pharmacy to make sure that they have that updated information. If you or a family member are taking long-term medications, such as for high cholesterol, you will receive a letter from CVS Caremark asking how you would like to receive those refills, whether by retail or mail order. And if you have questions about your specific coverage, you can always contact CVS Caremark or us at the GIC. Your contact information for CVS Caremark will be on your new ID card that you will receive in the mail. So finally, I just want to say a few words about dental and vision benefits. On the next slide, you'll note that there are no changes to dental benefits for those who are eligible. MetLife will continue to offer this coverage, and there are no changes to the plan. On the next slide, Davis Vision will continue to offer the same program for vision coverage with no changes. But one last time, if you have questions, use the Q&A tab within Zoom. So I've said several times that it's important to be engaged this year regarding your insurance benefits. Before we wrap up the presentation and take more questions, we want to give you a few tips on how you can prepare for annual enrollment. So when you're deciding which plan is best for you, plan ahead. Make sure that you get us changes before May 3rd when annual enrollment ends. Check with your insurance company to make sure that the network that they offer includes the doctors and hospitals that you want and has the benefits that you want. Number 3, contact your doctor, all of your healthcare providers to make sure that they accept the insurance plan that you're considering. And finally, if you're turning 65 soon, I hope you know that there are many steps that you need to take, so please visit the GIC's website. You will find a wealth of information there about things that you need to be aware of. And then finally, when you're deciding on a plan that's best for you, you may want to consider these factors. Location, where you live, will determine which plans you're eligible for. Coverage type, what kind of coverage works best for you? Is it broad access to providers that's most important, or is it premium costs that comes out of your paycheck that's more important? You have different options that can lead you in different choices. Are the doctors and hospitals you want in the network, as I mentioned before? If they are, what tier are they in, and what is the copayment for those providers? And how much are you willing to pay? The GIC willing and able to pay. The GIC offers plans with broad access, lower premiums, broad access, lower copays, higher premiums, but also those that offer lower copayments and lower premiums, along with more constrained access to providers. So decide which is the right combination for you. And just on the last slide, we close with a table for your reference that will have the phone numbers and websites for all the companies that the GIC works with, along with some other useful information for other organizations you will want to be aware of. So with that, before we move on to question and answers, I want to thank you for your patience and for attending this session today to learn more. There is more information coming your way beyond just this session. I've mentioned the benefit guides, which will be you will receive shortly. They will have loads of detail, much more than we can fit in a presentation here today. Please spend time with that. Your health plans, the health plans you're currently in, particularly if we're in a plan that is changing or being retired, they will also be reaching out to you directly. And as always, remember that you can check the GIC website for most anything that you need, any questions that you have. That is mass.gov/GIC. With that, let's move on to question and answers. I'll ask the GIC's Chief of Staff, Emily Williams, to share some questions that we think may be of interest to the broader audience here. Emily?
Hi, Matt. Thank you. So I have been monitoring the questions being asked in the Q&A and trying to pull those which we are seeing frequently asked and that I think would appeal to a large number of participants who are on today's meeting. If we could start by going back to the Medicare rate slide, I think since that was early on in the presentation, we have a lot of members who are asking to view that again. Thank you. We can just linger here while we address the first few questions. And again, as we go through this Q&A portion, if anyone has any questions that they'd like to ask, please use the Q&A function, and we have staff who are able to answer them directly or who will be able to, I will be able to see those questions as well if they apply broadly and pull them and ask them verbally. So the first question is about the information we're viewing today, asking if this information will be available after today's presentation and where that will be.
Yep. The answer is yes. That information will all be available. We will post this deck that we're using and a recording of this presentation on the GIC's website. So you can go to mass.gov/GIC. Again, this will all be in your benefit guides that you'll be receiving immediately before the annual enrollment.
Thank you, Matt. And you answered one of our second most frequently asked questions already on if there will be benefit guides this year, which you just mentioned.
Yep, there certainly are, and please pay close attention to them. We've put a lot of information in there for you all. That really should be the touchstone, kind of the core document that you're looking at to make your decisions this year.
Thank you. Members are asking, will I need to reach out to my doctor to let them know if I will be enrolling in a new plan?
Yeah, I think it's a good idea to do that. First of all, you want to make sure that they are in the network for the new plan. I think that's the most important part. And you know, again, if you're going to stay in the plan that you're in today, or you're being defaulted into a similar plan because you didn't choose one, in most cases that should not mean any significant disruption for you in terms of providers that are in your network, but you will want to be sure. And again, the copay level may change, the tier that provider is in may change, and you just want to make sure that they have that your doctor has your current member ID on file.
Great, thank you, Matt. And as I see people asking more and more questions in the chat, just one housekeeping item. I do want to ask if you could try to ask the question in one chat at a time instead of asking the follow-up questions, because we might lose your thread and we want to make sure that we know who's referring back. So if you do forget to include something in a question that you're asking, if you could include the whole question and ask it as a new question, we'll be able to better serve you with answers in that way. So the next question that we have is, and I think we can move to the, if we can move to the Medicare plan mapping slide. We have a lot of questions asking to see that again. Thank you. And the next question is about the, if you can talk a little about the CIC coverage again, Matt, if members will need to do anything to make sure that they're still receiving the coverage, or how that will work.
So the CIC coverage, let me just say a word about it. For some of you may be familiar with it, others perhaps not. So this is a longstanding addition, optional addition to the Unicare indemnity plans. It's a bit outdated, and having the member pay an additional premium 100% out of their pocket it made it stand out as different from all the broad network plans. So we wanted to take the opportunity of our recontracting period this year to finally fold this into the program. This is good news for our members. You will no longer have to pay that separate premium by yourself. If you're a retiree that has a 90%, the state pays for your premium, they will pay now 90% of that additional cost. It will just be folded into the plan. All the coverage and the cost will be folded into the plan. I will note that for those of you who, there's a small number of people enrolled in our Unicare plans without CIC, that will now be folded into the plan with CIC. So you're gaining additional coverage, really to bring your coverage up to date for 2023. This is something we wanted to change for a while, and we're happy to make the change here this time around. I hope that answered the question.
Thank you. We have a couple of questions about pharmacy, specifically on Medicare, while we're here on the Medicare slides. There's the question of, will Medicare enrollees receive a new pharmacy benefit card during annual enrollment? Or after
With that,
annual enrollment?
I will kick the question to Janine Dewar, key member of our team who manages our work with our pharmacy benefit managers. Janine, can you answer that one?
I believe that you'll be able to keep the same card. The benefits aren't really changing, but should the cards need to change, they'll be delivered to you prior to July 1st.
Thank you, Janine. And a follow-up question is, can Medicare retirees only visit CVS pharmacies?
That's a great question. I'm sorry, can you repeat the question?
It's for Medicare specifically. Medicare enrollees only visit CVS only pharmacies?
I believe I know the answer to that, but I think I'll kick that one to Janine as well to make sure.
You'll be able to go to other pharmacies. You'll receive for maintenance medications, for instance, high blood pressure, things of that nature. The 90-day supplies, if you want to go to a different pharmacy other than CVS, you'll have to let them know. But you'll receive letters that will instruct you on how to do that. But overall, you can use pharmacies other than CVS.
Yeah, so I think the high level reminder here is that for Medicare, for those of you enrolled in Medicare plans, the pharmacy benefit is not changing. So how you've been able to use your benefit, fill your prescriptions in the past, those will continue going forward. I do want to take this opportunity though to answer that question for non-Medicare retirees. So that's where we're making the change from Express Scripts to CVS Caremark. Also there, just because the pharmacy benefit manager is named CVS, that is different from the retail pharmacies that you know in your neighborhoods. So while the new pharmacy card that you're getting has the CVS name on it, you can continue to use a broad range of retail pharmacies, CVS if you like, but other pharmacies also if you like.
Thank you, Matt. And a more general enrollment question is, how can retirees who do not have access to a computer enroll in a new plan?
So you can continue to do it as you have in the past. And I think in that respect, I'll hand it over to Paul Murphy, who can speak to, our normal route of enrolling with us outside of using the member portal. I do encourage you to use the member portal, but if you can't or prefer not to, we can still interact with you by mail and by phone. Paul?
Sure, thanks, Matt. If a retiree doesn't have access to a computer, you can visit our website, mass.gov/GIC, and type in forms, and a member can see the form online that they need to download and complete, and they can mail it to our office to make any changes if they don't have access or don't want to use the portal. So just under the form section of our website, we'll give them the form they need to complete to make the change.
And if they don't have a computer at home, Paul, to download that form, how would they interact with us?
On GIC's website, we also have a section called MyGICLink, which will pull the form up directly online, but see, they still would need a computer. So either way, they'd have to be able to download the form and send it to GIC. Either through paper is the only way.
Thanks, Paul.
Thank you. And we have a question about when you can switch from a spouse's plan to GIC as a retiree.
That's another good question for Paul. Paul Murphy, Director of Operations.
You can switch from a spouse's plan to the GIC plan during annual enrollment. You can make the change using the forms or our portal. You can submit the form to GIC to make the change. During the year, if you are losing coverage through a spouse's plan through no fault of your own, and loss of coverage is a qualifying event, as long as you notify the GIC within 60 days of the loss of coverage, we will allow you to enroll in a plan with GIC at that time.
Thank you, Paul.
Thank you. And while we're on the subject, just quickly, it seems like we have some members who have joined today who will be eligible to retire after annual enrollment and are asking what they should do. And I think this is a good opportunity to direct individuals again to the chat, where I think Mike has dropped a link about the turning 65 in our retiree page for those who are not yet retired.
Yeah, it's a moment in your benefits when you turn 65 that it's really good to pay close attention, be in touch with us, look on our website, check out that video. There are a number of steps that you need to take, and we have a great deal of information there. You can also call us at the GIC, and people will be happy to walk you through it. Paul, I don't know if there's anything more on that you wanted to add.
No, I would just add, Matt, that if a member is retired 3 months before their 65th birthday, GIC will also contact them by letter, instructing them what they need to do to enroll in a Medicare plan with GIC. So we also send out a letter 3 months before the 65th birthday for the member. And if the member is also covering a spouse who's turning 65, GIC also sends a letter to the member instructing them that they can enroll in Medicare and join one of our plans. So during the year, people can switch to a Medicare plan when they're turning 65. It's not just during annual enrollment.
Thank you, Paul.
Thank you. And I think if we can move to the non-Medicare plan mapping slide for a moment, I think we have some questions on the non-Medicare side, asking which coverage is best if you reside overseas.
There you go. So here you'll see on the, Paul, you can correct me if I'm wrong here. You'll see on the second row here, New England and international residents. Today, your option is Unicare Basic, and your option in fiscal 24, starting on July 1st, is basically the successor plan that will look very similar, called Unicare Total Choice.
That's correct, Matt. For international residents, Unicare Total Choice is the plan.
Part of the reason for changing the name is that this new name really does more accurately reflect the underlying structure of the plan. It tends to be a richer plan for us. It's a simpler plan. We've made it more simple. It does have a higher premium, but with the higher premium, you get simpler copays. And now, of course, as we've said a few times, you no longer have that separate CIC premium that you have to pay. So that's why we changed the name.
Yes, and Matt, I'd also like to add on this slide here is this is a mapping so that people that, for example, are in the Navigator plan will be moved into the Harvard Pilgrim Explorer, POS, etc. If a member is satisfied with the way they are mapped to the new plan for July 1st, there is no need to complete any enrollment forms if you are happy with the plan that GIC is moving you. So we want to remind everyone, you do not have to complete enrollment forms. If you are satisfied with the mapping of where we're going to place you during annual enrollment, we will take care of the change for you. We will update the retirement deductions. We will notify the health plan that you are a member. So there is no action needed for members if they're happy with the mapping. If you'd like to change plans other than what's on this slide here, yes, then you would either have to change plans in the portal or download and complete paper applications and send them into GIC.
Thank you, Paul. And I think it's good to add that that applies for both Medicare and non-Medicare members.
Correct.
And we have a question if the coverage that has been, the benefits that have been discussed today, if this includes coverage for behavioral health providers, or is that separate?
Coverage for behavioral health services and providers are incorporated into your health insurance plan. So if you're in Harvard Pilgrim, your behavioral health services will be provided to you from through Harvard Pilgrim. You don't have to enroll in anything different. As people who are in Harvard Pilgrim know, and this is true with our other plans, some of them work with an outside company to provide behavioral health services. But from your perspective as a member, it's included in your health insurance plan. You don't have to enroll in anything separate. It's just the way certain plans have decided to cover the insurance benefit for behavioral health services.
Thank you, Matt. And of the plans here for non-Medicare members, which plan will offer the broadest coverage?
I think I would defer to perhaps Jim Rust or Cameron McBean, who manages our relationships with most of our health insurance companies. to answer
Sure.
that.
Yeah, I'm guessing that this is for members on active or non-Medicare plans, because Medicare plans, with the exception of the Tufts Medicare Advantage plan, allow you to see any provider who accepts Medicare. With regard to the non-Medicare plans, the largest networks, or the largest number of in-network providers, can be found on any of the Harvard Pilgrim Access America, although that's only available to subscribing residents outside of New England. And then Total Choice and Plus, offered through Unicare, they also can still offer in-network benefits to providers throughout the country, as well as the Harvard Pilgrim Explorer POS plan. That uses the same partnership that Harvard Pilgrim has leveraged for the Access America plan, in partnership with United Healthcare, which is the largest insurer in the country. So you still have access to that same nationwide network on the Harvard Pilgrim Explorer plan.
Yeah, I think the answer here, thank you, Cameron, for those details. I think the high level answer here is just about any of our broad network plans that are in the broad network category. Again, you'll see this in the benefit guides. They offer very wide choice among providers.
Thank you. And we received a few questions asking if we could go back to the non-Medicare rates slide.
So there are two of them. I think we'd probably, it depends on the question, but we may want to pull up the one that has the member pay portion. So the second rate slide.
Yes, I think so. There we go. And I'll just let it linger here for a minute while we answer some other questions.
While folks look at it too, I'll make a couple of notes. One is that these are your monthly premiums deducted from your pension, I guess, unless we bill you separately. So if you have, I'm sorry, I don't know too much detail about how frequently you get your pension checks. So it may, if you get them more than once a month, if you get them twice a month, you divide it in half. If you get it once a month, these will be your the deductions from your pension. Do I have that right, Paul?
Yeah.
Thanks.
Yeah, it varies across different entities and payroll pension systems. So just to be clear, that's why we post just the monthly premium, just so it's easier for everyone.
Thank you. And the next question I can answer, we're getting a lot of questions about the timing of the benefit guides. And I wanted to clarify that the benefit guides should be posted on our website by next week. So you will be able to view them on mass.gov/GIC. And they will be sent to retirees prior to annual enrollment, so that you should be able to have your copy prior to annual enrollment. But if you want to view them online or prior to then, they will be available on our website by next week.
And I do want to emphasize something we've mentioned a few times here, that all of the material that you need to know to make decisions will be in those guides. Here with this presentation, we wanted to give a preview for a number of the kind of key dynamics, so that you can start to think about and prepare for, making the decisions once you get your benefit guide. So everything you'll need is in the benefit guides when they arrive to you.
Thank you, Matt. And we've received a few questions asking if a Medicare enrollee can switch to non-Medicare to a GIC a non-GIC Medicare supplement plan and then switch back to a GIC Medicare supplement plan in subsequent years and annual enrollments?
That's a good question for Paul Murphy.
Yes, retirees can change from one Medicare plan to another Medicare supplemental plan during annual enrollment, but only during annual enrollment, unless in a small circumstance, they move out of a health plan service area. For instance, the Tufts Medicare Preferred is only a Medicare plan in Massachusetts. If they move out of state, that would be an event to change plans. But members have the option every year during annual enrollment to go from one Medicare supplemental plan to another supplemental plan and change back the following year.
Paul, I think they were talking about changing to a non-GIC Medicare plan.
If a member's in a Medicare plan, they cannot change back to a non-Medicare plan under state law. If you are eligible for Medicare Parts A and B, then you must join a Medicare supplemental plan. You cannot join back a non-Medicare plan under state law.
No, I'm sorry, Paul. The question, so if somebody were to say join a privately sold Medicare Advantage plan outside of the GIC, could they then rejoin the GIC at a later time was the question.
That's my
Yes.
understanding of the question, yeah.
Okay, sorry, I had so many different options, but yes, if somebody joins a Medicare supplemental plan outside of the GIC's offerings, they can join back with GIC during open enrollment, or if they lose that coverage through no fault of their own during the year, that's a qualifying event for them to enroll as well.
Okay, thanks.
Thank you. And Matt, if you can just clarify again, we're still receiving some questions about CIC and if that coverage is included in other GIC plans and or if it only applies to those that previously had it. If you could just give that clarification.
Yeah. So the CIC has applied only to, in the past, has applied only to Unicare plans. And in particular, I believe Unicare Basic and Unicare Medicare, Medicare Extension. So we are making changes to those Unicare plans, all of those Unicare plans, so that the cost and the coverage are included in your in the rest of the plan. It's being incorporated into the plan. It will no longer be a separate separate coverage or separate cost. I will note that with the change for those living outside of New England, we are also making that change in the new Harvard Pilgrim Access America plan. So anyone that has CIC today, whether you live in New England or outside of New England, that will be incorporated into your plan if you stay with the same plan or you're migrating to the same plan. I think I had that right. If I missed something there, Paul or Cameron or others, please correct me.
Nope, you had it right, Matt.
So you will not, you basically on a slide like this or any other, you will no longer see CIC referenced. The only reference to CIC in the benefit decision guides is that it is essentially going away as a separate item, but being incorporated into your plan. So you're not losing anything. I think you're gaining coverage. You're maintaining coverage for CIC, just not having to pay for it by yourself, and your benefits are essentially getting richer.
Thank you. And we have a question for New England residents. I believe this is for non-Medicare members. For New England residents who have a dependent who is living outside of New England, what plans are available for them? sorry, so this is for the enrollee resides in New England and they have a dependent who perhaps is in a student or something outside of New England. What plan options are available to them?
I'm happy to take this if you like, Matt. Sure.
Yep,
Uh,
go right ahead.
Unicare Plus or Total Choice or Harvard Pilgrim Explorer, as I said before, those are all plans that offer access to a national network of providers. The Unicare plan will basically allow you to see just about anyone, although your benefits and out-of-pocket costs will vary depending on whether or not it's someone within the Blue Cross Blue Shield networks. But yeah, those three broad network plans will offer in-network coverage on a non-emergency basis to any members and are available to any residents of New England.
Thanks, Cameron.
Thank you. And I'm just continuing to look through the questions. I do see a question asking if municipal retirees will also receive benefit guides, which they will. Paul,
Paul,
did you want to answer that
Yep.
say a
question?
word?
Municipal retirees will receive the benefit guides at home.
Thank you, Paul. I'm just giving our staff who are rapidly answering questions a minute. I have seen a number of questions asking about coverage if you are traveling outside of the US.
Yeah, again,
All
go ahead, Cameron.
Sure. All GIC plans offer emergency coverage while traveling. So if you are traveling, say you're on a hike somewhere, even if it's in the Himalayas, you break an ankle, you will have coverage. If you get dysentery in France, you will have coverage if you have to go to the doctor. The only time you'll run into trouble traveling outside of the country is for non-emergency care.
Those sound like dramatic examples, but yes. For the real adventurous among us.
Thank you. And I still am seeing a lot of questions asking if these materials will be available after the presentation. And yes, they will be posted to our website, and the recording of this session, as well as the session later this week, and all of the active sessions will be available on our YouTube page.
While our staff are going through the questions to see which ones we pull out, I did see one that I'll just take. So someone asked if, let's see if I can put my fingers on, are doctors' offices aware of the new changes to the GIC plans and coverage? So they may be, they may not be. I would say that we rely on our health plans to inform doctors' offices that are in their network of any changes to plans. But this is, again, an area where it really would behoove you to make sure that you're in touch with your doctor's office if you are changing a plan, or if you're not making a choice and we are default enrolling you into a plan. You're going to want to make sure that they're aware of those changes. So a combination of our health plans notifying them, and I think you being in touch with them will be sufficient to make sure that goes smoothly. And if you're, one of the things that you will see in your benefit guide that I'll note here is that, as you're reviewing your doctors and whether they're in the network, each of our health plans has an online directory that shows which providers, which doctors, which hospitals are in their network and not in their network. Also notes what the co-payment tier is for each of those providers. So again, another resource as you do your homework about which plan works for you.
Thank you. And if we can move back to the Medicare plan mapping slide, I see a lot of requests to take a look at that again. There we go. Thank you.
Yeah, I saw a note that some folks have only been seeing the non-Medicare plan details. You may have missed the opening part of this presentation where we went through specifically the Medicare plan changes, including those that are sort of captured here. So again, if you missed that, you can watch the video, pull up on our website or our YouTube channel, or just look at the deck that we will also post on the website.
Thanks. And we have a question about clarification for both Medicare and non-Medicare enrollees. If you are changing plans, will you receive a new benefit card?
I think I know the answer to that, but Cameron, you want? If you are changing plans,
I'm sorry. I
right.
was typing a response. What was the question?
Will both Medicare and non-Medicare enrollees receive new cards if they are changing plans?
Yes, if your plan is changing names, you will receive a new medical ID card, even if it's just changing names. So if you are currently in Unicare Basic and it with CIC and you're moving to the new Total Choice, you will still receive a new ID card, even though nothing has really changed about your coverage.
And this applies to the Medicare enrollees as well.
Correct. So anyone currently in the Tufts Medicare Complement Plan will receive a new Harvard Pilgrim Medicare Enhanced card. Anyone currently in the Harvard Pilgrim Medicare Plan who's staying there will not receive one.
Fantastic. Thank you, Cameron. And I did see a question asking if Thursday's session will be the same as this session. And I wanted to clarify that, yes, it will be the same presentation and just another opportunity and time for members to join and ask questions. And we have members asking if we can go back to the Medicare rate page for the member rates. Thank you. And we do have questions asking if we will post questions and answers. We will be posting and sharing the frequently asked questions from all of the sessions, compiling the frequently asked questions and posting those on our website along with the answers. And the staff is hard at work answering questions. I see some members still looking for clarification, if you don't mind, Janine, on the use of non-CVS pharmacies, particularly for Medicare members. If Medicare members will be able to access non-CVS pharmacies for their prescriptions, such as Walgreens.
Yes, we'll still have that access. And CVS will send out information should there be any concern with needing to inform them about a non-CVS pharmacy, and that will be specific to maintenance medications, again, blood pressure medications or anything that's long-term.
Thank you.
While we're waiting, I saw a question just come in. Can you clarify the difference, what the difference is between Medicare and non-Medicare coverage? Well, I'd say the biggest difference is eligibility. So if you are an individual who has paid in to Medicare with sufficient quarters to qualify for Medicare, then you enroll in our Medicare plans. But we do have a pretty substantial number of our members who just based on their employment, they work for the state for long enough time that they have not paid into Medicare through their FICA taxes to enroll in a Medicare plan. For those individuals, your coverage is through the non-Medicare plan offerings that we have here.
Thank you. And I see.
Yeah, if I may, I see a question here about Harvard Pilgrim's family rate actually going down, but we said there's an increase. So here I just want to note something. So with the Tufts Navigator plan and the Tufts Spirit plan being discontinued, again, due to the merger, not because we didn't want to continue offer them. For those of you who are in those Harvard Pilgrim plans and stay in those Harvard plans, in some instances, your premium may decrease. If you are in one of the Tufts plans and you don't choose a different plan and you are migrated into those Harvard Pilgrim plans, the premium will be higher. So in essence, if folks don't make a separate choice, then the people who are in both of those plans are being brought together into one plan. And that will lead to some decreases and some increases that are not insignificant if you're in the Tufts plans. What we show in that slide is a blend of those two populations, but this is a good time, particularly if you're in those Tufts plans, to evaluate what your options are, because you may have less expensive options with a different plan than the one that we would default enroll you into. I hope that's a little complicated, but I hope that's helpful.
Thank you. And we've had a number of questions asking if a member moves outside of New England after annual enrollment, if that is a qualifying event.
It's probably a Paul question. I believe the answer is yes.
Yes, if the retiree or member is in a non-Medicare plan and they move outside of New England, moving is a qualifying event. For instance, they can change to the Harvard Pilgrim Access America plan. If they move out of New England, it's a qualifying event. As long as you notify the GIC within 60 days that you are moving, we will allow you to change to that plan. If you're in a Medicare plan, all the Medicare plans cover you nationally except for the Tufts Medicare Preferred, so there is no need to have a change because it's a national network on the Medicare. So it's important between the two, whether you're Medicare or non-Medicare, but non-Medicare qualifying event to change plans moving out of the service area.
Thank you. And as we are nearing the end of the session here, I am giving those GIC staff who are answering questions in the chat sometimes to continue answering those. And I just want to remind everyone again that the benefit guides will be mailed to retiree members. They will also be available on our website starting next week. And that is the best place to evaluate all of these options side by side. And this presentation, the deck from this presentation, will be available on our website to view at your own leisure, as well as recordings of these presentations will be available on the GIC YouTube page.
I see that we're running up on time. We've got about 5 minutes left. There are kind of a flurry of questions about eligibility for Medicare and sufficient quarters paid in, and a few unique circumstances here. If we don't get to those before we finish this, I would just encourage people to reach out to our operations staff directly. We can, as we wrap up, we can bring up that slide on how to contact us before we finish. There's a question, is medical coverage the same for Medicare and non-Medicare plans? They are different plans. I just want to be clear about that. And so I see Andrew is answering that question. But they are different plans, there's no question. This has raised a kind of a higher level policy question for us, which we are still interested in addressing. Medicare plans really are more designed for retirees and anybody that, you know, is of Medicare eligibility age. So we are interested in exploring solutions to that, and making those who are not today eligible for Medicare to make them eligible for Medicare. But that is not happening as a result of this year's set of decisions, but something that we continue to work on at the GIC.
And again, just another reminder that if you have personal questions about your coverage, in the chat, there is the phone number to the GIC as well as the link. And if you have specific questions about coverage, you're welcome to call any of the carriers, or if you want to know if your doctor accepts the any of the plans prior to, as you evaluate your options, we encourage you to make sure you check with your doctors and hospitals.
As we draw to the end of our time, perhaps we can bring up a slide that shows the information on how folks can contact us, either by phone or through our online contact form. Perfect, thank you.
And as we near the final minutes, I'm just giving staff some time to wrap up answers to questions. And again, we will be posting a frequently asked questions document on our website that members can review if any of these questions come up as you evaluate your options during annual enrollment.
See that someone asked, could you please address the behavioral health question again? So behavioral health services are covered in every instance by all of our plans as part of your health insurance plan, just to be clear about that. All right, I'll let staff continue to answer questions. We are just about at time. I want to thank you all for participating in this session. I hope it was helpful to you. Again, just to remind you that this is a preview of other materials that you will be receiving over the coming weeks. Most importantly, your benefit guide. That will be your key document to review as you make decisions about your coverage for the coming fiscal year. Again, all your coverage will remain the same. Plans that you're in will remain the same through the end of June. But during that annual enrollment period, starting on April the 5th, this will be your chance to kind of make changes in your coverage, choose different options if you would like to do that. Again, just note that if you're in a plan that's changing dramatically or is being discontinued and you are okay with the plan that we have mapped you to, we will enroll you in that plan and you don't need to take further action. I would just, for those in that instance, just make sure that the plan that we're mapping you to and enrolling you in meets your needs, both the premium, the network. We've tried hard to make sure that those plans are as similar to the plan that you're in today as possible, but it's a good idea just to make sure that that is the case for you. So with that, I want to thank everyone. I want to thank my team at the GIC for assisting with all the question and answers. This is not your only chance to interact with us. I do hope it was helpful, but if you have further questions, please reach out to us through that online contact form listed here, the phone number listed here. This is complicated stuff, and these are really important decisions. I think you know that, we know that, and we want to be helpful to you in any way that we can. So thank you again for participating, and have a great rest of your day. And thanks for being GIC members.